CEN Exam Prep Dates. Question 1. A patient presents with a complaint of severe headache and photophobia. The patient has a temperature of 101 degrees Fahrenheit and nuchal rigidity. Which triage category is most appropriate? Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. A patient with fever, nuchal rigidity, and photophobia is at high risk for meningitis and requires rapid assessment, ESI 2. The patient is not unstable enough for ESI 1A, but needs to be seen quickly. Question 2. Which of the following is a contraindication to the use of continuous positive airway pressure, CPAP, in a patient with respiratory distress? Option A, COPD exacerbation. Option B, hypoxemia. Option C, confusion or inability to protect the airway. Option D, mild asthma exacerbation. The correct answer is option C, confusion or inability to protect the airway. CPAP requires a patient who can protect their own airway. A confused patient or one with an unprotected airway is at risk for aspiration and should not receive CPAP. COPD exacerbation, A, is an appropriate indication, as are hypoxemia, B, and asthma exacerbation, D, with caution. Question 3. A patient presents with acute kidney injury. Which laboratory finding is most consistent with prerenal azotemia? Option A, BUN/CR ratio 20:1. Option B, BUN/CR ratio 10:1. Option C, normal BUN/CR ratio. Option D, elevated CR with normal BUN. The correct answer is option A, BUN/CR ratio 20:1. In prerenal azotemia, decreased renal perfusion, the BUN/CR ratio is typically 20:1 due to increased reabsorption of urea. In intrinsic renal disease, the ratio is typically 10:1, B. Normal ratio, C, and elevated CR only, D, are not characteristic of prerenal azotemia. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient with a known history of aortic stenosis presents with syncope. Which medication should the nurse avoid administering? Option A, 4-normal saline. Option B, 4-nitroglycerin. Option C, 4-morphine. Option D, 4-oxygen. The correct answer is option B, 4-nitroglycerin. Patients with aortic stenosis depend on preload to maintain cardiac output through the narrowed valve. Nitroglycerin reduces preload and can cause severe hypotension and cardiovascular collapse in these patients. 4 fluids, A, are appropriate to maintain preload. Morphine, C, should be used cautiously. Oxygen, D, is safe but not the primary concern. Question 5. A patient in her second trimester of pregnancy presents with painless vaginal bleeding. What is the priority assessment? Option A, fetal heart tones. Option B, maternal vital signs. Option C, cervical dilation. Option D, contraction pattern. The correct answer is option B, maternal vital signs. Painless vaginal bleeding in the second or third trimester is concerning for placenta previa. Maternal hemodynamic status is the priority. Assessment of fetal heart tones, A, and contraction pattern, D, are important but secondary. Cervical examination, C, is contraindicated until placenta previa is ruled out due to risk of catastrophic hemorrhage. Question 6. A patient who is intubated and mechanically ventilated has a sudden decrease in SpO2 from 95% to 85%. The ventilator alarms are sounding with high peak pressures. What is the first action? Option A, increase VO2. Option B, assess for a disconnection. Option C, manually ventilate with a bag-valve mask. Option D, suction the endotracheal tube. The correct answer is option C, manually ventilate with a bag-valve mask. When an intubated patient experiences a sudden drop in SpO2 with high pressure alarms, the immediate action is to disconnect from the ventilator and manually ventilate with a bag-valve mask, BVM. This allows assessment of breath sounds, compliance, and tube patency. Increasing FiO2, A, may help briefly but does not address the underlying issue. Suctioning, D, may be needed later. A disconnection, B, would cause low-minus pressure alarms, not high pressure. Question 7. A patient who has ingested a large amount of acetaminophen is at risk for? Option A, acute kidney injury. Option B, hepatic necrosis. Option C, pulmonary fibrosis. Option D, cardiomyopathy. The correct answer is option B, hepatic necrosis. Acetaminophen toxicity causes hepatic necrosis due to accumulation of the toxic metabolite NAPCI, which depletes glutathione and damages hepatocytes. Acute kidney injury, A, can also occur but is secondary. Pulmonary fibrosis, C, and cardiomyopathy, D, are not associated with acetaminophen toxicity. Question 8. A patient presents with a chief complaint of suicidal ideation. Which of the following questions would be a priority for the nurse to ask? Option A, do you have a plan? Option B, what medications do you take? Option C, do you live alone? Option D, have you attempted suicide before? The correct answer is option A, do you have a plan? When assessing a patient with suicidal ideation, determining if they have a specific plan, means, and intent is the priority. This directly addresses the patient's immediate risk. Other questions, B, C, D, are relevant for history but do not assess imminent risk as directly. Are you looking for CEN Exam actual questions? Visit our website pokerexams.com to access CEN Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN Exam answer key today. Question 9. A patient presents with tachycardia, palpitations, and weight loss. What endocrine disorder is most likely? Option A, hyperthyroidism. Option B, hypothyroidism. Option C, diabetes mellitus. Option D, Cushing's syndrome. The correct answer is option A, hyperthyroidism. Hyperthyroidism presents with tachycardia, palpitations, weight loss, anxiety, and heat intolerance. Hypothyroidism, B, presents with bradycardia, weight gain, and cold intolerance. Diabetes, C, presents with polyuria, polydipsia, and polyphagia. Cushing's syndrome, D, presents with weight gain, moon phases, and hypertension. Question 10. A patient presents with agitation, confusion, and is hyperthermic after ingesting a street drug. The patient's pupils are dilated, skin is dry, and the patient is tachycardic. What is the most likely drug involved? Option A, cocaine. Option B, methamphetamine. Option C, anticholinergic drug, example PCP. Option D, ecstasy. The correct answer is option C, anticholinergic drug, example PCP. The anticholinergic toxidrome is characterized by red as a beet, dry as a bone, hot as a hare, blind as a bat, mad as a hatter, flushed skin, dry skin, hyperthermia, mydriasis, dilated pupils, and delirium. Cocaine, A, and methamphetamine, B, cause tachycardia but also diaphoresis and constricted or dilated pupils depending on the stage. Ecstasy, D, can cause similar symptoms but typically also includes diaphoresis. Question 11. A patient presents with sudden onset of sharp chest pain and dyspnea following a long flight. What is the most likely diagnosis? Option A, spontaneous pneumothorax. Option B, pulmonary embolism. Option C, acute coronary syndrome. Option D, pericarditis. The correct answer is option B, pulmonary embolism. This patient has risk factors, prolonged immobility from a long flight, and classic symptoms of pulmonary embolism, sudden dyspnea and pleuritic chest pain. While spontaneous pneumothorax, A, can cause similar symptoms, the history of prolonged travel makes PE more likely. ACS, C, presents with chest pressure with radiation. Pericarditis, D, pain is positional. Question 12. A patient with suspected renal colic has a temperature of 101 degrees Fahrenheit. What is the priority nursing action? Option A, administer for pain medication. Option B, obtain a urine sample. Option C, notify the provider immediately. Option D. Administer antiemetics. The correct answer is option C. Notify the provider immediately. Fever in a patient with renal colic suggests a superimposed infection, which can rapidly progress to urosepsis. The provider should be notified immediately so antibiotics can be initiated. While pain medication, A, is important, the infection needs to be treated promptly to prevent sepsis. Question 13. Which of the following ECG findings is most consistent with pericarditis? Option A, ST-segment elevation in all leads with reciprocal depression. Option B, diffuse ST-segment elevation with PR-segment depression. Option C, ST-segment elevation in contiguous leads with reciprocal changes. Option D, pathologic Q waves in leads 2, 3, and AVF. The correct answer is option B, diffuse ST-segment elevation with PR-segment depression. Acute pericarditis classically presents with diffuse, global, ST-segment elevation across most leads along with PR-segment depression. The ST-segment elevation is concave upward and does not have reciprocal changes. Option A describes STEMI, which typically shows ST elevation in contiguous leads with reciprocal depression. Option C also describes STEMI. Option D describes a prior inferior wall ME. Question 14. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO 324 milliequivalent/L. What is the most likely interpretation? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option C, respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO 2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO 2. Question 15. A patient presents with severe right upper quadrant pain radiating to the right shoulder, nausea, and vomiting. The nurse anticipates a diagnosis of Option A, acute pancreatitis. Option B, acute cholecystitis. Option C, peptic ulcer disease. Option D, gastritis. The correct answer is option B, acute cholecystitis. The classic presentation of acute cholecystitis is severe right upper quadrant pain radiating to the right shoulder or back, Care's sign, along with nausea and vomiting. Acute pancreatitis, A, pain is epigastric and radiates to the back. Peptic ulcer disease, C, is epigastric pain. Gastritis, D, is epigastric burning or pain. Question 16. A patient presents with alcohol intoxication. Which assessment finding is most concerning? Option A, slurred speech. Option B, gait instability. Option C, nystagmus. Option D, decreased level of consciousness. The correct answer is option D, decreased level of consciousness. Decreased level of consciousness is the most concerning finding in alcohol intoxication as it may indicate severe intoxication, hypoglycemia, head trauma, or other co-ingestions. Slurred speech, A, gait instability, B, and nystagmus, C, are expected signs of intoxication. Question 17. A patient is brought in with a nail gun injury to the chest. What is the priority nursing action? Option A, remove the nail. Option B, apply pressure to the wound. Option C, obtain a chest X-ray. Option D, assess for pneumothorax. The correct answer is option D, assess for pneumothorax. A nail gun injury to the chest can cause pneumothorax, hemothorax, or cardiac injury. The priority is to assess the airway and breathing. The nail should not be removed, A, as it may be tamponading a bleeding vessel. Pressure, B, may be applied but the priority is assessment. Chest X-ray, C, will help determine injury but follows assessment. Question 18. Which of the following is a classic sign of a hip fracture in an older adult? Option A, internal rotation of the affected leg. Option B, shortening and external rotation of the affected leg. Option C, adduction of the affected leg. Option D, flexion of the affected leg. The correct answer is option B, shortening and external rotation of the affected leg. A hip fracture typically presents with the affected leg shortened and externally rotated. The patient is unable to bear weight. Internal rotation, A, is more common in hip dislocation. Adduction, C, and flexion, D, are less specific findings. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with a history of DVT presents with sudden onset of chest pain and dyspnea. What is the priority nursing action? Option A, administer oxygen. Option B, obtain a 12-lead ECG. Option C, prepare for CT angiography. Option D, administer heparin. The correct answer is option A, administer oxygen. The ABCs are the priority. Administering oxygen to treat hypoxemia is the first step. ECG, B, is used to rule out ME but is secondary. CT angiography, C, is diagnostic but not the priority. Heparin, D, is treatment but follows oxygen and diagnosis. Question 20. A patient presents to the emergency department reporting slurred speech and an unsteady gait for about 6 hours with complete resolution of the symptoms. Which of the following statements by the patient would be a priority to follow up? Option A, I haven't been able to refill my blood pressure medication for a few weeks. Option B, I use cannabidiol, CBD, edibles to help me sleep. Option C, I was diagnosed with Guillain-Barré syndrome as a child. Option D, my grandmother had rheumatic heart disease. The correct answer is option A. I haven't been able to refill my blood pressure medication for a few weeks. This patient's symptoms describe a transient ischemic attack, TIA. Uncontrolled hypertension is a major risk factor for future stroke and requires immediate intervention. While CBD use, B, may be important, it is not as critical as uncontrolled hypertension for TIA management. Guillain-Barré, C, can cause similar symptoms but is not the priority. Family history of rheumatic heart disease, D, is less relevant. Question 21. Which fracture requires immediate surgical intervention? Option A, clavicle fracture. Option B, open fracture of the tibia. Option C, radial head fracture. Option D, ankle fracture. The correct answer is option B, open fracture of the tibia. Open fractures are surgical emergencies that require immediate 4 antibiotics, tetanus prophylaxis, and surgical debridement to prevent osteomyelitis. Clavicle fractures, A, radial head fractures, C, and ankle fractures, D, are typically managed non-surgically or with delayed surgery. Question 22. A patient with anorexia nervosa presents with significant electrolyte abnormalities. Which electrolyte finding is most concerning? Option A, hypokalemia. Option B, hyponatremia. Option C, hyperkalemia. Option D, hypercalcemia. The correct answer is option A, hypokalemia. Hypokalemia is the most common and concerning electrolyte abnormality in anorexia nervosa, particularly related to purging behaviors. It can lead to cardiac arrhythmias, weakness, and QT prolongation. Hyponatremia, B, can occur but is less common. Hyperkalemia, C, is not typical of anorexia. Hypercalcemia, D, is not associated. Question 23. A patient with COPD is receiving supplemental oxygen. The nurse is most concerned if the patient's oxygen saturation is maintained at which level? Option A, 88-92%. Option B, 93-95%. Option C, 96-100%. Option D, 85-88%. The correct answer is option C, 96-100%. In COPD patients, the goal is to maintain oxygen saturation between 88-92%. Excessive oxygen can suppress the hypoxic drive and lead to hypercapnic respiratory failure. A saturation of 96–100% is too high and may worsen ventilation in these patients. Saturation below 88%, D, is too low. Question 24. A patient is brought in with suspected carbon monoxide poisoning. What is the most important diagnostic finding? Option A, carboxyhemoglobin level. Option B, ABG with POW2. Option C, methemoglobin level. Option D, white blood cell count. The correct answer is option A, carboxyhemoglobin level. Carboxyhemoglobin, COHB, level is diagnostic for carbon monoxide poisoning. ABG POW2, B, may be normal despite severe hypoxia because co-binds to hemoglobin. Methemoglobin, C, is seen with other toxic exposures. WBC, D, is nonspecific. Question 25. A patient presents with an acute shoulder dislocation. The nurse notes the arm is held in abduction and external rotation. What is the most likely type of dislocation? Option A, anterior dislocation. Option B, posterior dislocation. Option C, inferior dislocation. Option D, superior dislocation. The correct answer is option A, anterior dislocation. Anterior shoulder dislocation is the most common type and typically presents with the arm held in slight abduction and external rotation. Posterior dislocations, B, are less common and present with the arm held in adduction and internal rotation. Inferior, C, and superior, D, dislocations are rare.